Okay. Hi guys, welcome to Empower Parkinson's. I'm Dr. Alison Geimer, physical therapist. Dr. Valerie Johnson is here with us. She is not on camera today. She's going to be moderating and taking questions. So let us know you're here and shoot any questions that you have or that come up. Today our guest is Dr. Marie Warner. She's also a physical therapist, and she is a certified women's health specialist. So we are going to chat with her about things that are probably embarrassing that we don't bring up. You may not even bring up to your doctor. And so we hope that you get some good information here and come away with some helpful info. So Marie, just tell us a little bit about you and your practice. And
Okay, so I am a physical therapist. My specialty is women's health, or actually like pelvic health. And so the main clients that we see at our clinic, so I work at Warner Physical Therapy, which, yes, that's my last name. And it is actually in the hospital district in the Fort Worth, Texas area. And we see a lot of people that come in that have issues that are pelvic floor related, including incontinence, urinary frequency, urinary urgency, constipation, just pelvic pain in general. And so those are the main, well, we also see other things too. We see male pelvic floor for the same types of things, any bladder or bowel related issues, also like pelvic pain, like low back pain. We see all of that. We also see like women during pregnancy and postpartum. But those are those are all the main things that we treat at my clinic, or at our clinic. There's two therapists. There's myself, and then there's another therapist, Tanda. She is full-time, and she also specializes in that area as well. And so that is a little bit about what we treat in my clinic.
awesome. All right. So Valerie and I, we get a lot of questions, or we just hear a lot of people make comments about being incontinent, and their doctor just puts them on a pill, which most pills, they may help a little bit, but a lot of people don't see like complete resolution. So if somebody came into your clinic and said, you know, I have incontinence, I've been on this medication, I've tried all these other medications, what would be the first thing that you would do with them?
Okay, so if somebody comes in, the first thing that we're going to do is we're going to take a detailed history, because the reason is there are lots of different types of incontinence. You know, there's basic stress urinary incontinence, which is just incontinence with increases in intra-abdominal pressure. There is urinary urgency, where you feel like you have to go to the bathroom and like you're running there and you don't make it, and you pee your pants all the way there, or maybe halfway there, or you can't get your pants unbuttoned fast enough and you start leaking. There can also be mixed incontinence, where it's a combination of both things. There can also be leakage related more to the bowel system. So if patients are coming in and they have issues with like constipation or fecal incontinence and things like that, all of those things can relate to the urinary tract as well. And so we take a very detailed history, find out what types of medications, find out what things are creating or causing leakage. Sometimes people just say, oh, I'm just sitting there and I leak. And so those are things that we need to know about, because they can be pertinent to someone's progress. And so the next thing we do is we talk about what the pelvic floor is, because most people don't even know what that is. What that is a basket of muscles at the bottom of the pelvis that has a support function as well as a sphincteric function, which means that it controls the little sphincter around the urethra that applies compression to that area. And so whenever you get the urge to go to the restroom or increases in pressure, that little sphincter is supposed to provide compression around the urethra. There's also a sphincter around the rectum that helps with continence, or making sure that you don't leak during the day, stool. That is. Anyways, and so we talk about what the pelvic floor does. So the support function, the sphincteric function, it also has a sexual function. And so then from there, we want to do an exam. We want to assess how that muscle is working. Because whenever you're talking about pelvic floor, some people are like, oh, I do my Kegels all the time. Well, that's great. And I'm glad you know what those were. However, it doesn't necessarily mean, one, that that's your issue. Okay, I always tell people, if you think of a muscle like on a linear line, your muscle needs to be able to contract and it needs to be able to relax. If it doesn't do one of those two things, then it's not working properly. And then what you may be doing may actually be hurting or making it worse. And so we want to assess how the muscle functions. Can it contract? Do you have good strength? Is it an effective contraction? Can it relax completely? And then after that, we take a look at endurance. What kind of muscle endurance do you have? That muscle works all day long. If you think about the time of your day that you're up doing stuff, it is a long time. So that muscle needs to have really good endurance to run the marathon of life. And so it needs to be able to provide that support as well as do that sphincteric function so you're not having these symptoms. So we look at endurance. We also look at control. Have you ever sneezed and you peed your pants? Well, there are two different types of muscle fibers in the pelvic floor. There's the fast twitch and then there's the endurance muscles. So we need to look at both and we need to address both to make sure that you're able to do both things during the day. And so we do an exam. And so after explaining all those things, the type of exam that we're going to do, which it'll make a lot of sense, like after we talk about all of those things, is an internal exam. So the reason is because, again, those muscles are very internal. And so the best way to palpate them and to get an idea of how they're functioning is to palpate them or touch them. And so that way we can have the best knowledge of how that muscle is functioning. And those are the things that we're looking for during that exam.
Okay, awesome. Well, that was a lot of information, guys. I hope you got that. Be sure to play that back later. She talks fast for me, so. Okay, so those clients that come in and they say, hey, I've been doing Kegels for forever. So if their muscles are actually like hyperactive,
or
they're actually
non-relaxing
working against them.
Exactly. If you were to go to the gym and try to get a really great, so what a non-relaxing pelvic floor or a hyperactive or hypertonic, all of those terms are used for that type of pelvic floor. I call it a non-relaxing because at the end of the day, what's happening is it may be able to contract, but it is not relaxing completely. And so you don't have full range of motion of that muscle. And so if you were to go to the gym and you wanted to get a big bicep and all you did was this, that's not going to do very much. You want to have full range to really get a good muscle strength built. Same thing with the pelvic floor. The only difference is it's kind of hard to tell what you're doing in that area because we've kind of dissociated from it. And so yes, if you're doing Kegels and you've done them forever, you could be doing them incorrectly. But yes, if you have a non-relaxing pelvic floor and you try to do a bunch of Kegels, it could actually make it worse, or you get no results with it. And that is like if you were trying to do a contraction with a not full range.
And is that something? So a lot of folks with Parkinson's, they get a lot of cramping and just kind of muscle tightening in general. Is that something they can feel going on in their bladder, that it's hyperactive?
The bad thing is, because your pelvic floor is so close to the center of your body, we don't have great 2-point discrimination in that area. Some people can feel, oh, I have some like cramping at my bladder, or oh, I have this pain here, or I have like pain running down the inner thigh. Like it can be really hard to differentiate the two on your own. Some people will just feel the symptoms of it. Like it could be anything from low back pain to like cramping, like if you were having period cramps, pain when you're about to try to relax to go to the bathroom, pain after or during a bowel movement, all of those things could be symptom. Pain with intercourse, like that is a one with someone with a non-relaxing pelvic floor. That's something that they may feel.
Okay, so that's interesting to me. So let's talk about that. So pain in the back and going down the thigh, front of the thigh. When, other than those things you just mentioned, would they feel that just intermittently? Could they possibly, because I do have folks that complain of pain in those areas.
Mm-hmm.
Could they possibly be feeling those just intermittently, randomly throughout the day, or only when they're doing certain activities?
It depends how tight the muscle is. And it really depends, and it really just depends on the person. So some people, they'll come in, and typically the pelvic floor, it can refer like to the adductor, which is like the inner thigh. And so sometimes when people come in and they feel that, it's whenever they've been on their feet a lot, or they're doing an aggravating motion or movement or activity. And so it could just be while they're doing that really aggravating activity, and then they lay down or take a hot bath and it makes it better. Same thing for the back. It could just be during that activity. If a muscle is just so aggravated, it could last, it's typically, I would think it's typically like during those activities. Sometimes it can just be when they're in like a standing or against gravity position, if the muscle is really aggravated.
Okay. All right, cool. So, let's talk about people that have frequency or urge frequency, especially at night.
Mm-hmm.
And they have to get up multiple times during the night, so they're losing sleep because of this issue. What can they do for that?
There's a lot. So one of the things that we do in the history is that I ask what kinds of things they're drinking. There's something called bladder irritants. And what those are, they are substances that we ingest that aggravate or just really tick off the inside of the bladder. And so your bladder wants to get rid of them because it doesn't like them. And so then you pee all the time. And so water is the most neutral thing. Things that are classified as bladder irritants include milk, caffeine, so coffee, tea, caffeinated or decaffeinated, anything that has like a lot of artificial sweeteners in it, that can be really aggravating. Sodas, anything that's real carbonated, it can be classified alcohol. Sorry, can be, and everything is in moderation. Some people are like, well, I only have like one soda a day, and it's like, okay, one soda a day is not going to put you in the bathroom for hours. But if you're drinking a gallon, I literally have had somebody come in, I drink a gallon of tea a day and I pee all the time. No shit. Like, I would too. This is a normal response to that amount of bladder irritant. And so just making sure that you're drinking everything in moderation, that you're getting plenty of neutral, plenty of water to keep your bladder happy and also keep you hydrated. Another thing that people will do if they go all the time is that they'll not drink water because they say, if I drink, that makes me go all the time. And I'm like, well, what happens is your urine can get really concentrated and actually turn into a bladder irritant itself. And so then that can make you feel like you have to go all the time. So you're really not winning either way. And so I'll tell people, okay, you need to drink your fluids starting in the morning, and you want to just sip on your water really frequently during the day. And that way you're getting all your water intake in. Another thing people will do is they'll wait until the evening because they forgot to drink their water. And so then they're chugging water at night. Well, then you go to bed like 4 hours later and you're getting up all night. That's another no-no. You want to start in the morning and you want to drink it consistently during the day. And so that way you're not surprised at the end of the day and like, oh no, I didn't get it in. This way you get it all in. What was the question? Okay, frequency. It was frequency and urgency. So that is a huge component of it. Another thing that we want to take a look at is the bowel. Like if you have constipation, that can put a lot of pressure on the bladder. So what happens is when your pelvis is just not huge. You know, your rectum is right here, the vagina is right here, or not even the vagina, the bladder, but it goes rectum, and then there's the vagina, and then there's the bladder, or there's the rectum, and then there's the bladder in the man. And anyways, if it's full, it's going to provide compression against the bladder. So it can actually shrink the size of the bladder, and it can create urgency as well. And so I'll make sure patients, one, that they're going to the bathroom every day. If they're coming to me, even though, you know, the definition of constipation is going 3 times in a week, if someone's coming to see me, I want them going at least on a daily basis. And the reason is because of that. It can provide a lot of compression against the bladder, which can create that urgency itself. Now, if they're having normal bowel movements, then we take a look at, okay, sometimes this can just become a habit. You know, like, have you ever stopped at a gas station and your mom said, go to the bathroom? Well, that is called just in case voiding. We call it jicking. And so when that happens, you can actually be training your bladder to go more frequently. So your bladder can develop this new sense of full and say, okay, when I get to this level, we're gonna go. And I'm gonna just make a big deal about it. Instead of getting this full. And so you're really not using a good majority of the capacity of the bladder. And so anyways, so we go over, okay, well, do you get a good amount out when you go here? Do you get a good amount when you go here? And we also want to know about, okay, have you had any urodynamics done? Are you completely emptying your bladder? If you're not completely emptying, that can be a sign of neurogenic bladder, but it can also be a sign of other things as well, like you're not relaxing your pelvic floor completely. And so those are all things that we want to talk about and kind of discuss. Another thing, what types of medications you're on. If you take a lot of allergy medicine or things that kind of dry up your sinuses, like that can have an impact on your bladder. And so those are all things we want to talk about and discuss. But if someone has urgency of frequency, it can be related to all of those things.
I have a question. Can I ask a question from back here?
Please.
Okay. All right. So I just read this the other day. I'd never heard this before. So with foot swelling, people have swelling of the feet for various reasons, and then when they finally lay down at night, the swelling in their feet re-enters the circulation, and it causes increased urination at night.
Could.
Did you already mention this? I'm sorry.
No, I didn't.
But that's something I'd never heard of. So will you repeat that so they could hear you? When people lay down at night and they have a lot of swelling in their feet, and then when they prop their feet up, like the swelling comes back and like kind of is filtered like through their system, and then they pee it out. That can also happen like with body work, like soft tissue, lymphedema. So like if someone has lymphedema and they're like getting reduction, like they can increasing their urinary frequency isn't abnormal. So those are all those are things that can contribute, but it wouldn't be long term. But if you have congestive heart failure, or if you tend to have a lot of swelling in your limbs, one, that is something that you probably want to speak to your doctor about. But two, diet is huge, because if you have like a high salt diet and all of that, like that could contribute, but it can affect your bladder.
So, you good?
Yeah, I'm good.
All right. So going back to bladder irritants, is there anything other than just those liquids that you mentioned? Like, is there actual foods that could irritate the bladder? So
foods are a little tricky, and the reason is, yes, there are certain foods that can aggravate the bladder, but those are not one size fits all. And so those can affect some people and not necessarily others. So like spicy foods can impact some people and create frequency. Other people may not have an issue. Chocolate, because it has the caffeine, could impact your bladder. Some, not everyone. Anything that's real acidic, like lemonade. If you're drinking a gallon of lemonade, that's not good for you either. And if you're doing the little like the water sweeteners, you have to be mindful at what kind of artificial sweeteners are in those, because that can increase your urinary frequency and can be a bladder irritant. that is pretty definite on that. I mentioned it earlier, but I just wanted to reiterate.
So which artificial sweeteners would those be?
I would say anything. Like Crystal Light, I know for a fact because I had a patient email me about it. He was like, he was doing great, and then he went back to work, and he's like, all I did was add this Crystal Light to my water. And I'm like, stop. That's why you're peeing and leaking all the time. But anyways, so like Splenda can be a bladder irritant. The pink packet. What's the pink packet?
Sweet and Low?
Sweet and Low. Clearly I don't use them a lot. Stevia I think is usually pretty okay because it's from it's from a plant and stuff like that. But I think it really depends. Everyone's bladder is a little bit different. And so if you have something that has stevia in it and you feel like you're going all the time, it could just be impacting your bladder that way.
Okay. All right. So what do you recommend people do if they are trying to tease out what is irritating their bladder?
If you're ingesting something and you don't know if it's impacting your bladder or not, one, just don't have anything other than water for maybe like a day. And kind of, I would do a bladder diary and write down your frequency. Okay, I went to the bathroom here, I went to the bathroom here, went to the bathroom here. The next day, do the same thing and then add in one thing and then mark down your frequency. If you're going more, it's not rocket science. That is creating frequency. But if you're not, then it's probably okay. In moderation, everything is okay in moderation. We don't want to go crazy with it. Like if you have one carbonated water and it was fine, okay, great. Don't drink a case of them. Yeah. Everything is okay in moderation. So I think that would be the easiest way to tease things out if you're drinking something. Now, if you think it could be medication related, you definitely would want to be under the care of a really good urologist who could help you kind of look through your medications and help you maybe tease out which ones could be impacting you. And so don't do that unless you're under the care of a good physician that can help you with that, because you obviously don't want to be messing with your medications unless your doctor is aware of it.
Cool. All right, so I have a question from one of my clients. We may have talked about this a little bit, but so they tend to have more urgency at night, but she also has more pain at nighttime. So and her pain is like low back pain. So how would that, just the pain itself, does that play a role, or is that maybe a consequence of the bladder issues that might be going on?
The pain as a result of the bladder issues?
Yes.
So if someone feels like if you have back pain definitely, there is a study, let me think, 9 out of 10 women who have low back pain have pelvic floor dysfunction. And so if you have back pain, one thing that I would definitely do is come in and be assessed, because we just want to make sure that your pelvic floor is functioning correctly. If it's not, then that's something that we want to address and rule out, because it could be contributing to low back pain. And if your back hurts primarily at night, that can definitely impact your pelvic floor because they're so close. But it would definitely be something you want to look at and, again, rule out to make sure it's not contributing to it.
Okay. So let's say somebody, one, I don't know if you mentioned, we'll post your office address and stuff on our site. But
okay.
If somebody doesn't live in this area, how can they find a good men's health specialist?
So the section of women's health, they have a find a therapist link, and so you can go on there and kind of read what they're proficient in. We're not all trained the same, but those people have done continuing education through a proficient company. And so, their experience levels and all that can vary, but that is a good place or a good starting point to find someone. Now, if you find someone, you go and you're like, maybe I'll find someone else on, go to the list and go to the next one down. But just, you'll find one on there. Like there's some really great providers on there. And again, they've all trained through that company. And so they're really great classes that they've taken, and they have good education.
So you just Googled the section of women's health?
Mm-hmm.
Okay. All right.
Will that pop up as PT?
No, it comes up as the section.
The section. Okay.
Section.
But it's if somebody just puts in section on women's health, it'll be the PT section. On women's health. Okay.
Yeah, it'll be the PT,
sure.
the PT section, and then you just click on it, and then on that very front page, there is a link that says Find Therapist or Find a Therapist.
Okay.
All right, so let's talk about just constipation itself. Let's say somebody has no bladder trouble whatsoever, but they complain of being constipated all the time. What are some reasons that might be occurring specifically in our Parkinson's population? I can tell you a couple, but I'll let you tell me your opinion.
So the number one cause of constipation is dehydration. So lack of water intake. The second thing is what you're eating and how you're eating it. So some people will skip breakfast. Well, that is not okay, in the sense that is what helps kind of stimulate your gut and kind of gets things started. And so if you don't eat until much later in the day, then your body won't have gotten food, and so food is what stimulates stool to kind of pass through. And so how people are eating can have a big impact. And so we go over a bowel routine of, when you wake up, this is what you do. You need to, when is a good time to have a bowel movement? We want to find time in your day, because in our society, we don't find time and we don't give ourselves enough time. And then helping people establish a routine, because your gut loves routine. It wants to know when you're going to feed it, how much you're going to feed it, and when you're going to feed it. So yeah, time and amounts are really important, and consistency with it is really important. Other things can be medications. Unfortunately, there can be some medications that are probably good for that person, but that can be a risk factor, is constipation. And so, looking at your medications closely and seeing what the side effects are. There's one patient that came, and he always felt like he's like, I just feel like I have gas. But the first medication he was on, that number one side effect was gas. So it's well, this is probably causing it. And so just looking at your medications and being knowledgeable on that. And then, if that medication can't be changed, then finding something that can help with that. Maybe that's increasing your fiber intake. Maybe that is introducing a stimulant that can be helpful. So those are things that you can do that can help. Another thing, it can be more related to a motility issue. And so if it's motility, then that is because your colon is lazy. Not really, it's not your fault. But that is more, that is a whole other can of worms of probably need to go under a GI doctor and have things assessed and stuff like that. But if it's just purely I have a sensation that something is there and I can't go, or I only go a couple days a week, those types of things, it's probably more related to what you're drinking, what you're eating, and how you're doing it. And then it can also be a muscle function. So the pelvic floor, again, has a sphincteric function of the urinary system as well as the bowel. And so if we've gotten in this habit of delaying our urge to have a bowel movement, you can actually train a muscle to not relax well enough for the stool to come down for you to have that sensation. And so that can create constipation. So there can be a coordination issue between your muscle and your system. And so that can be another cause.
Cool. So, random question. You know about the Squatty Potty?
Yeah, I love the Squatty Potty.
Will you tell people what that is and how it could help?
Yeah, so a Squatty Potty is actually a great invention that's been around for a really long time, way before it was on Shark Tank. But what it is, it's a stool that gets your legs in a position to help relax your pelvic floor. So that way you can empty more completely because the muscle, the pelvic floor, is more relaxed.
And so, do you recommend that both for urinating and
I do. When patients come in, a lot of times if they have difficulty eliminating, like if they feel like they're not completely emptying their bladder, and we've gone through all these things, I will recommend the Squatty Potty, especially if you have really high toilets. You know, depending like where you live and if it's a new house or an old house, but some of the toilets now can be really high and it's not conducive to your pelvic floor relaxing completely. And so I would highly recommend it for someone who like, yeah, my toilet's a little bit high, or I don't eat it, or like if your hips are not getting to 90 degrees or greater, I would definitely recommend it to someone.
So it would be good for people that have elevated or not a bedside commode, but you know what I'm talking about.
Yeah, like a higher toilet because of that.
What is that?
Elevated.
If you have like a bedside commode over your toilet, or like the ones, just the plastic seats that you put to make your toilet higher from CVS or whatever, that would probably be a good thing.
Yeah.
There's a lot of people I know that we treat that have those. So.
Yeah, it would be really good for them.
Okay.
And the good thing is it goes right under your toilet seat. And so it fits right under there. You can pull it out when you need it. So it won't necessarily be a fall risk or anything.
That's good to know. That's good to know. Okay. So going back to urgency, if let's say somebody's getting up 4 or 5 more times a night to urinate, but they're really not going a whole lot, just kind of a few trickles here and there. Should they get up every time they have an urge? And if not, what should they be doing instead?
Well, so if they drank wine before they went to bed, then it's probably due to the irritant. If they drink a ton of water, so those types of things. So if you don't drink, so if someone's waking up that much at night, I would say, okay, before you go to bed, like 2 to 3 hours, let's cut off your fluids. Make sure you get all your fluids in before night. Before that time, and then let's make sure you cut off your fluids at that specific time. And then if they're still getting up a lot, if they have good enough like pelvic floor strength to be able to do what we call an urge suppression technique. So it's where you like squeeze your pelvic floor muscles, kind of do little pulses like with the muscle around the urethra. It can actually inhibit the bladder from contracting and then try to roll over and go back to sleep. Some people have fear. They're fearful that they'll leak. And so in some cases, depending on, you go to the bathroom regularly, you're not drinking anything, there's nothing that you're ingesting that's contributed to this frequency, but you've done this for so many years. Pelvic floor strength is good, all of that. Sometimes, like with some of my patients who've had true overactive bladder, because it could be overactive bladder, whenever you have a lot of frequency at night, it could also be a lot of other things. So it could also be like IC, there's other things that could contribute to that. So
could be what? Sorry, can you say what IC is?
IC, which is interstitial cystitis. I'm not saying anyone has that does that, but I'm just saying like it would take a lot more questions to kind of say, okay, this is what I would recommend. And so it could be beneficial, to just do an urge suppression technique and roll over. But if they're having pain associated with it and stuff like that, that's definitely something that I would probably refer them to a good urogynecologist or a good urologist to just do a little bit more differential diagnosis and make sure that there's nothing going on the inside of their bladder.
Anything that you want to mention about some of the more common like bladder medications that people get put on, like how effective you feel like they are, or
So medications can be effective for the right person and for the right reason. I know that a lot of the medications out there, they try to perfect them, like Vesicare, and there's Mirabetriq, and there's Detrapan and Detrol and all of those. The bad thing about all those medications is that the side effect is dry mouth, and it's really, really bad dry mouth. And so with patients that have come in, and we've had really good success, and yet there's some that, they still require a little bit extra intervention, but we've had some patients who come in and completely get off some of their medications, obviously under physician guidance, but they've been able to completely get off some of those medications because their frequency, they were able to get it under control and sleep through the night, or jump and not have, leakage, or sneeze or cough without anything. And so it's definitely worth a try. If you don't like being on medications and you're willing to put in the effort, like pelvic floor therapy can be really effective. And so it's a good place to start.
Awesome. Do you have other questions? Do we have any questions?
Gosh. I feel like I did, but now I lost it. I don't see any other questions coming in. Okay. I know people are watching me.
I know. I didn't figure most people would want to blast themselves on out to the world that they have.
Yeah.
Let's see, I had... So how many average sessions would you say that you see somebody for bladder or constipation issues? I know everybody's different, but...
Everyone's different. Usually the range is anywhere from like 1 to 6 times. That's a pretty good range. If they're having a lot of pelvic pain, it's more. And again, it's person to person. I've seen a person, 2 times and was super diligent with everything, and they were like, that made a huge difference.
Yeah.
That means doing your home exercise program and sticking to your nutrition plan, guys.
That's
so let's talk about constipation and nutrition real quick. So, do you think that dairy plays a role in increasing constipation?
Yes.
Okay.
Yes.
Any other foods increase constipation that you know of?
Or like bananas. There's lots of different foods that can impact. Yes. So all dairy, not just milk, like cheese. My daughter's only been constipated 1 time in her life, and her stool was literally like
From
this
cheese?
big. Yeah, and I told her, it was she's 3 guys, so, but I kept telling her, I'm like, you're gonna be so constipated. And I thought her little butt was I thought her little rectum was gonna rip. It was the saddest thing. So it's a known fact. Dairy will thicken your stool. If you're not drinking appropriate amounts of fluid. And so you got to make sure that you're having like good fiber and good water intake. And she drinks a lot of water. And so if you have a ton of cheese, you are going to have the biggest poop ever. Dairy is a for sure. And it's also a gut irritant.
Yeah.
And so
it also progresses your Parkinson's faster. So my clients who are doing our contest right now, you should know that. And just another reason to keep away from that dairy.
Yeah.
Dairy sounds awful now.
It is, I know. And I used to love milk, but...
We don't even have it in our house anymore.
Yeah.
There is a really great colorectal doctor, and I went and spent some time with him in his office, and that's one thing he tells all his patients is to get off dairy, because it's so aggravating to your gut.
Yeah. That includes ice cream, guys.
I know. And what if they just put a little milk in their coffee? Is that still bad?
Oh, it's not good. But everything is okay in moderation, right?
Right.
And so it doesn't sound worth it now. It could make you poop a huge stool, and then it could make your Parkinson's worse, and
it can irritate your bladder.
It can irritate your bladder. Yeah, there's just all kinds of things that it's not good for.
Also,
the better way to grow your bones is to exercise.
Yeah.
Weight bearing exercise.
Yeah, and also just as PTs, we should mention just exercising in general helps mobilize your intestines. So
yes, it really does.
People realize that.
That does too. Yes, exercise is good for you. Jumping around is good for you.
Or just walking if you can't jump. But moving in general gets things moving in that area.
Yes.
So less constipation, less pain.
I love it.
Cool. Anything else? Anything else you want to share?
No, I mean, I think we covered everything.
Okay. All right. Cool. Well, thanks for joining us today. Next time, guys, we're going to go over different aches and pains you might have and ways to alleviate those. Again, that doesn't involve pain medication, and that you can do yourself at home.
Yes.
Anything else to add?
Yeah, so if y'all have any questions about certain aches and pains you're having or have had, like feet is a common one. I'll hear people have cramping in their feet, shoulder, whatever. Just keep those in mind for next time.
Yeah, and we will post on the Empower Parkinson's site, we'll post Dr. Warner's contact information. So if you guys are in the area and say, yes, that sounds good, I want to go see her and not have this problem anymore, you can contact her. We'll also post, if Valerie didn't already, how to look up somebody in your area. What else? I was going to say something else. Do we need to post anything?
If y'all have any more questions after the fact, we can always answer them.
Yes,
too. Okay.
private message us, because we know it's a sensitive issue. Obviously, we don't want to talk to everybody about peeing and pooping our pants or not pooping our pants. So, all right, bye guys.
Bye.